You've mentioned a couple of times that you believe it's essential that everyone be covered. I don't think you've used the word mandate, but that's what it is. And mandate, like ration, is a word that scares a lot of Americans. What is your thinking, though, behind that point, that everyone must be covered?
Well, in this country, we value our freedom. But I think along with the right to be free and the right to, at least the moral right, if not the legal right to have health care, comes a fundamental responsibility. And that responsibility is at least to help keep yourself healthy and to make yourself responsible for at least part, subject, of course, to the ability to pay, of the health costs involved with keeping you healthy. It isn't fair to say, I'm going to put that responsibility on somebody else. That's what a lot of people today are doing, especially young people. So I'm not one who believes that an individual responsibility requirement, just as we have for auto insurance today if you drive a car, is going to cover automatically everybody who ought to be covered. I think there has to be a corresponding willingness on the part of our country to help those who can't afford that responsibility on their own. So it has to be a combination, helping those who can afford it, but requiring of all of us, where we can, to pay at least our fair share.
So you have a working woman. She makes too much to qualify for Medicaid, but she can't afford health insurance. Under your plan, what happens to her?
Under my plan, she would be required to have some form of health insurance. She could choose, but up to perhaps 400% of poverty, she would be eligible for assistance from the government to assure that she could buy the plan of her choice. I know you've probably followed this and talked about it on some of your programs. The alternative today is what we're seeing in Oregon, where Oregon, for that woman, subjects herself to a lottery. Right. And she, if she's lucky, wins the lottery to get a health plan. I don't want to see that spread across the country. That's not the way to cover people.
And still using this woman in her workplace, if her employer, we presume, is not offering insurance, what would that employer have to do under the Daschle plan?
Well, I'd like to see, and this would be a matter that I would leave to the Federal Health Board. I don't want to get too far into the weeds with regard to how we make these managerial or executive decisions, but my preference would be that the employer contributes something as well. It is part of one's compensation package, retirement, health, and livelihood. That, to me, is just a fundamental tradition and economic fact that employers and employees come together, recognizing that an employee's health is in the interest of the employer as well. To have a person stay well is something employers are recognizing to a far greater degree than ever before, with the acquisition of health equipment and health rooms and better diets and an emphasis on wellness that we see with employers all over the country.
They would either have to provide insurance or pay into a pool.
Correct.
Right. Some of your ideas are playing themselves out in Massachusetts since that state passed reform. Do you see anything in the Massachusetts experience yet that tells you whether these ideas are still, as you thought they would be, good ones?
Well, I believe that the connector idea is really the Massachusetts version of a federal health board. I like a lot of what the connector is all about. It basically creates that framework and works to try to set in place the infrastructure that Massachusetts is using. I also like this individual responsibility requirement that they've passed and the idea that employers would contribute. Now, obviously, they're going through growing pains. They're going to have to do a lot to try to resolve many of the challenges they're facing, but we would expect that. I think it would be a mistake for us, in any case, to anticipate that we're going to solve all these problems within a year or 2 years. This is going to be a gradual period, and I think it's going to take some time to evolve into where it is we want ultimately to be. And with that time, we're going to see greater and greater results. That, in my view, is what the Massachusetts experience will show.
I know you've been asked to talk about this before, and I ask you to talk about it again today. You're the co-chair of the Obama campaign. He calls for a mandate on kids only. Hillary Clinton calls for the individual mandate, closer to your plan.
Well, that's right. And Barack and I have talked about it. I believe that Barack is right, too. What Barack is saying is that mandates don't work unless people have the capacity to fulfill that mandate. And we have a large percentage of the American people who are not eligible for Medicaid, but not capable of buying health insurance. Even those we know from studies that have been done, we know that 37 or 40% of the people who have insurance still can't afford health care. So we've got to find ways to address the economics of health just as we do the legal requirements of health. And that's really where I see common ground between Hillary and Barack. Hillary says it ought to be a responsibility. Barack believes that as well, but he thinks it ought to be with the help of the American people, because we really are in this together.
I have a final question. You spend a lot of time in this book analyzing what's gone wrong in past attempts at health care reform, and how do you create the right political climate for success. I guess I would ask you, looking forward, and I know it's hard in this moment, but what are the chances of some changes, not necessarily yours, but some changes occurring?
Well, I would put it on a spectrum of time. In the short term, I would say the chances are not very good. In the longer term, I don't think we can avoid having to confront these issues in a very meaningful way. What happens in our republic historically is that one of two factors usually drive large change. We either see it through crisis or we see it through leadership. Sometimes we see it through both. This could be crisis-driven in the very near future. I'm hoping that it will be leadership-driven, that within the next few years, perhaps as early as this time next year, we could actually begin a debate, a national debate, about how we make our healthcare system better.
At the moment when we're talking, which is mid-March of 2008, the economy is in a great deal of turmoil. When that happens, doesn't it make having a conversation about such a large, important, complicated subject like this even more difficult?
I think it does, but I think this is wedded in so many ways to the state of our economy. You know, when General Motors spends more on health than they do on steel, and Starbucks more on health than they do on coffee, and when we spend a far greater percentage of the cost of each car on health than our competitors, this becomes a huge competitive question. And it becomes a question for families. Can they make ends meet financially? That becomes a major economic question for so many families and businesses today. So this is very intricately connected to the whole economic issue. So in some ways it actually helps us.
Okay. Thank you so much, Senator Tom Daschle, author of Critical.
My pleasure.